My name is Brittany Willard, and I'm going to be presenting my reflective evidence organizer for typical and atypical preschool FCSC 2910 section online 1 spring 2017. The first objective is to recognize and apply the theories and principles of human development, growth, and learning with a primary focus on children aged 3 through kindergarten. The following domains of development should be included: sensory-motor, cognitive, adaptive, language and communication, social, aesthetic, emotional, and physical. In Chapter 14, IDEA requires states to provide special education services to all children with disabilities ages 3 to 5. Motor development involves improvements in strength, flexibility, endurance, and eye and hand coordination, and gross motor movement and mobility and fine motor control. Cognitive development is when children are able to sort and count objects, remember things that they have done in the past, and plan decisions about what they will do in the future. Integrate newly learned information with previously learned knowledge and skills, solve problems, and generate new novel ideas. Communication and language development is all forms of communicative development, including the ability to respond nonverbally with gestures, smiles, or actions, and acquisition of spoken language sounds, words, phrases, sentences, and so on. Social and emotional development is when children feel good about themselves and how to express their emotions and feelings. Objective 2. Identify and describe potential impacts of general and specific disabilities, delays, or risk factors on the different domains of development. In Chapter 7, Autism Spectrum Disorder is a developmental disability affecting verbal and nonverbal communication and social interaction, generally evident before age 3, that adversely affects the child's educational performance. Other characteristics often associated with autism are engagement in repetitive activities and stereotype movements, resistance to environmental change or change in daily routines, and unusual responses to sensory experiences. Objective 3. Recognize and respect the major cultural and sociological differences in child development and views of the child as a functioning individual within the environment. In Chapter 13, gifted and talented people across ethnic groups demonstrate communication skills, imagination and creativity, humor, inquiry, insight, interest, memory, motivation, problem solving, and reasoning. Current best practices for identifying gifted and talented students from different racial and cultural groups involve a multi-factor or multidimensional and multimodal assessment process that meets these criteria. Objective 4. Examine the interaction between biological and environmental factors that have a direct influence on or that place the child at risk for developmental delay or disability. In Chapter 5, Learning Disabilities, it stated, although virtually impossible to document as primary causes of learning disabilities, environmental factors, particularly impoverished living conditions early in a child's life and limited exposure to highly effective instruction in school, probably contribute to the learning problems experienced by many children who receive special education. Objective 5. Explain how children learn in a holistic manner rather than fragmented ways and the inextricable link between communication skills and the quality of concrete experiences provided through early concept forming activities. In Chapter 14, it states that successful early intervention programs help children make progress in each of the developmental areas already described. Because young children with disabilities are already behind their typical developmental age mates, early childhood special education should use only instructional strategies that lead to rapid learning. Objective 6. Analyze the interrelatedness of all domains of human development for both typical and atypical children. In Chapter 14, it stated virtually all early childhood educators, whether they work with typically developing children and or those with special needs, they believe that learning environments, teaching practices, and other components of programs serving young children should be based on what is typically expected of and experienced by children of different ages and developmental stages. Objective 7. Describe the etiology and symptomology and classification of common developmental disabilities or conditions in young children and their developmental impact. Difficulty with reading is by far the most common characteristic of students with learning disabilities. Evidence suggests that specific reading disability, sometimes called dyslexia, is a persistent deficient, now simply a developmental lag in linguistic or basic reading skills. The most severe reading problems of children with learning disabilities lie at the word level processing, and the most common cognitive limitation of these children is dysfunction in the awareness of the phonological structure of spoken words. Phonological awareness refers to the conscious and understanding of knowledge that language is made up of sounds. Objective 8. Describe the ages and stages of growth and development and understanding of the range of behaviors appropriate for each developmental stage from 3 through 5 years of age. One empirical test CBA tool is assessment, evaluation, and programming system for infants and young children. The AEPs is divided into 2 levels, one for infants and toddlers from birth to 3 years old, and one for children 3 to 6 years. The AEPs is divided into 6 areas of development: fine motor, gross motor, adaptive, cognitive, social communication, and social. Each domain is divided into strands that group related behaviors and skills considered essential for infants and young children to function independently. Objective 9. Utilize knowledge of cognitive, social, affective, and psychomotor development in planning and in instruction. Knowledge must inform decision making. Practitioners must know about a child's development and learning, about each child as an individual, and about the social and cultural context each child lives in. The breadth of developmental domains and the activities that young children typically engage in provide an almost unlimited number of possibilities for instructional objectives. In conclusion, during this course regarding typical and atypical development, I learned how to think on a higher thinking level when learning how to break down and take in what I learned about the different types of learning disabilities faced in special education. The assignments that were assigned allowed me to learn how to properly research on a topic on the web. I learned from the readings that the different types of symptoms associated with each learning disabilities children experience and how teachers can help children learn despite of what kind of disability they have. Educators should be able to integrate instructional context easily into the child's daily routines and taught in a meaningful way that represents the use of the skill. I plan to apply what I learned when I am in an educational learning setting. I will also keep in mind to provide supported instruction to remediate delays caused by the child's disabilities and prevent any secondary disabilities from developing. I would also ensure that modifications and adaptations of the physical environment, materials, and activities are provided to support successful participation in learning. And thank you for your time. This is the end of my presentation.